Today we are going to be performing a full body skin cancer screening on one of our staff members. Thank you, Juliana, for coming in.
You're welcome.
We're going to be looking at her from head to toe, and we just wanted you to be able to see how we actually go about doing the full body skin cancer screening. So when you come in, you'll be given a gown. You can wear your bra and underwear, but we actually prefer when you come in that we take off everything, and that way we can easily examine your skin. You will be covered up during the exam, however. If there's any areas that you do not want us to check, just let us know when we start the exam. So Juliana, are there any areas of concern today? Anything that's itching, bleeding, or changing color? No. Okay, so I'm gonna start with your scalp. So have you just kind of look down, thank you. We're gonna look through your scalp. And Juliana did the right thing because she came in today without any makeup, any jewelry, any hair products, because that allows us to get a better, thorough exam. Good. I'm going to check behind your ears. Now, I have diagnosed skin cancer on pretty much every body part, including behind the ears, the fingernails, lips, genital skin. Close your eyes for me. And that's why we look everywhere. Turn your head this way. Turn your head this way. You can open up your eyes, open your mouth for me, and then close. Now, Juliana is wearing a bathing suit underneath this, just for purposes of the exam. But like I said, when you come in, we will ask that you remove your undergarments so that we can get a good look at everything. But since she's on camera, I'm going to keep her kind of covered up here. Okay, good. So you have some normal moles on your back. Everything looks good so far. Let me see your hands like this. We're going to be examining your fingernails too. Like I said, I have diagnosed skin cancer of the fingernail. Flip for me this way. And Bob Marley died of a melanoma on his toe. So another reason why we check everywhere, because we see skin cancer on all ages, all skin types. Maybe lift up like that, thank you. Good. Okay, so normally I'd be checking the chest here, and we're gonna have you lift up your legs, and when you're ready, you're gonna lay all the way flat. Okay, comfortable? Okay. So we're gonna check her feet here, so just have you kind of flex like that, good. So actually, Juliana has a mole on her foot, so I'm gonna use a tool called a dermatoscope, and this just allows us to get a closer exam. It's a little light here. Okay, this doesn't hurt, you're just gonna feel me kind of up close and personal. So everything looks great with this mole, it goes with the normal skin lines. Okay. Good. Look at the front. Perfect. All right, so because we are trying to keep her a little bit covered up, I'm not going to show you everything, but I would be examining every area here. So both sides of the legs on the front and the side, excuse me. Okay, and this is where I would check her abdomen and the lower groin. Go ahead and sit all the way up. How you feeling? Good. Okay, I'm going to have you stand whenever you're ready. Just go all the way down this way. Okay, Juliana, just have you face like that. Thank you. All right, so again, we're going to be checking the backs of the legs. I would be looking at the buttocks. Let me have you turn it this way. You know, a lot of people don't want to come in and have the full body exam because they're like, I don't need to do that, or you're a little shy or nervous. But I will say that, you know, I've seen a lot of skin cancers on areas where people just did not want to have examined. I did have a patient a few years back that I had been examining his upper body for years, and then every time he came in, I asked if I could check his legs, and finally he let me check his leg, and he had a big melanoma on his leg. So, you know, melanoma can be life-threatening, so it's important that you come in once a year to get a checkup. Do you have any questions about your exam today?
Nope.
Okay. Well, I didn't see anything suspicious. Everything looks really great. I do recommend that you come in once a year at a minimum to come in for your full body exam. If anything is itching, bleeding, or changing, then you should come back sooner. Also, I would recommend that you wear your sunscreen. Make sure you choose something that has zinc or titanium dioxide, reapply every 2 hours, and come in if you need us, okay? Thank you so much for coming in today. We do recommend that you come in once a year. We would love to see you here at Paris or Dermatology. Please call us at 622-6315. Thank you.